What time is class over? Now?
No.
Or 45?
No.
Speakers calling?
Yeah. Okay, any questions here, guys? Okay. All right, modified sims. Modified sims in a sims position. These are just, positions, projections. They are given names of the doctors that invented them or discovered them. Okay, sims, the true sims position is an oblique position between the side and prone. Between your side and prone is the sims position. The modified sims is, it's only the hip that's rotated, but the top portion of the body stays in the lateral position. So it's only this portion, the hip portion, is rotated away from you. That's a modified sims. And I'm sharing this particular position with you is because this is the position that we most commonly do in one of our procedures. Can you guys think of what this would be? Exactly, when you put it in. Okay? So this, we put our patients in the modified sims position for the insertion of the enema tip to the rectum when we're doing a barium enema. Underwear off, of course. Okay, and they're going to be covered, and you are preserving their modesty, but this is the most common position. So it's right leg over the left, hip slightly oblique. That's the modified sims. And again, we'll cover this again, revisit it again later on. All right, this is the modified lithotomy position. This is used when we are inserting a urinary catheter. Okay, so this is a modified sims. So what is, modified lithotomy. So what is the true lithotomy position? Legs what? Yeah, so your knees are going to be perpendicular to your hips. So your knees are going to be pushed up over here. Like when you're delivering a baby, that's your lithotomy position. Okay. Modified, the legs are a little bit more relaxed. True lithotomy, your knees are going to be up here. Oh, there we go. Like that. Okay. Oh, I already jumped ahead. So we already covered this, right? So here we have an individual who's standing upright. So this particular projection and position, projection is a lateral projection. Lateral projection, what's the position? Erect. What else?
Upright.
Upright, what else? What kind of lateral? Right lateral. Okay? And then here they are lying down. Is it laying down or lying down? Okay, okay, they're laying down, okay? And what is the position? Right lateral, recumbent, and what is the projection? It's just a lateral, okay? Everybody got it? Okay. Oblique positions. Oblique positions. Yeah, this is getting good. Okay, oblique positions. Here we have, on the left, what's known as a posterior oblique. A posterior oblique. So the patient is oblique, and their posterior, one of their posterior sides, is going to be pressed up against the image receptor. Okay? Now, the specific category for this position is going to be based on which side is closest to the image receptor. Okay? So in this oblique position, the posterior portion is pressed up against the image receptor, but which side is it?
Left.
Right. It's the left side. So now this becomes a left posterior oblique. Here's another one. She's in an oblique position with her left side closest to the image receptor. The right side is furthest away from the image receptor. So again, it is qualified by what side is closest to the image receptor, the left or the right. So now this is the hey guys, can I have just, it's hot in here, so we have to have the doors open. Yeah, so we're kind of hearing everything that you guys are saying. Okay, thank you. Okay, so this is the left posterior oblique. They're on their posterior side. So again, it's the side that's closest to the image receptor. So that's the posterior side. And then we have to qualify which side is it. Okay, so this is a left posterior oblique, or for short, we're going to call it
LPO.
an LPO. Okay, an LPO. Anterior obliques. Okay, anterior obliques. The anterior surface is closest to the image receptor, but which side is it? Is going to be your qualifier. So here we have what? A right anterior oblique. Okay, is this kind of making sense? Okay, kind of making sense. That's good. Yes, you still would. Okay. So if we were to ask you if they were lying down or if they were upright, you would also identify that. Okay. All right. So what's this?
Right anterior oblique.
It's the right anterior surface oblique. Okay, so right anterior oblique or RAO. And then what do we have here? Left posterior oblique or an LPO.
Sometimes we say, on the previous slides, we said lateral, right, recumbent.
Huh? Here on this slide?
No, on the previous one,
Oh,
like
okay.
3 or 4. And then on this one, we're saying projection, then position first. So like, is there sometimes the projection first and sometimes what? No?
No. So sometimes we mix them up.
So there's no rule of like the projection
there
is
really
first?
is no rule of thumb, but generally what we have done is we say the projection first and the position second.
And then like,
As a general rule, it's not always like that, but you know, if you're not giving any type of descriptor on there, if you're just saying, you know, right lateral and then recumbent, or you know, you have to say whether or not you're talking about the projection or the position. So in other words, I would say right lateral position, lateral projection.
which
To identify what to
it
describe
makes the
what it is
projection
I'm
last
talking
up first.
about. No, yeah, I mean you can do either one, but
Okay.
again, just make sure you're describing the correct terms.
Okay.
Okay, so I wouldn't just say right lateral. Okay, now I'm a little bit confused.
Right.
So if you say right lateral position, right lateral recumbent position, any lateral projection, now I know what you're talking about.
Okay.
I can even say lateral projection, right lateral recumbent position. See, I just switched the order, but I'm describing what it is that I'm talking about.
But both are okay.
Yes,
You're not
both
just
are
like,
okay.
oh, you're an idiot,
No,
but you
no,
put
no,
your
no.
position
Both,
first.
both are okay, as long as I can distinguish the projection from the position.
Thank you.
Yes. Sorry, Ms. Smith is wanting to know what's going on. Yeah. Okay. We already did this. Okay. Why are they duplicates? Okay. Oh, I did go backwards. Okay. All right. You guys ready for the wrench? I'm going to throw a wrench in here now, okay? These are what's known as decubitus positions. Decubitus positions. Okay? But first, let's talk about the position. Okay, let's talk about the position here on the top. What position is our patient in? Don't look at what's here, what I have here. Let's look at the image. What is the position?
Left lateral recumbent. Or
Okay, it is, I heard it, lateral.
left lateral.
Okay, so left lateral recumbent
Recumbent.
position. Left lateral recumbent position. Now, here's the wrench. I'm not talking about a projection that's going from straight down vertically. Now I'm looking at a beam that's horizontal. Okay? So what is the projection here?
It's an AP.
It's an AP, yeah, that's fine. It's an AP projection. Okay? Now, when I'm describing a decubitus image, there are two things that's got to happen. Okay, you guys listening? Okay, a decubitus examination, number one, the patient has to be recumbent. Okay, so the first one is the patient has to be recumbent. And now the projection, instead of it being vertical, it's horizontal. That's the second part of a decubitus examination.
Can you repeat that?
The first one or second one? Okay, the first one, the patient has to be recumbent. The second one, you need a horizontal beam. Okay, we're talking strictly about a decubitus examination. A decubitus examination. Those things need to happen. All right? Now with what you know, let's describe this again. What are we going to call this?
Left lateral recumbent
Left
position.
lateral.
Recumbent position.
No, okay. Good. Okay, so everybody's thinking, okay? So this is known as a left lateral
Decubitus.
Okay? Because just by simply saying decubitus, it's telling me that the patient is lying down and that my projection is horizontal.
You have to say AP decubitus or PA decubitus?
Okay, so now Nick is asking, is it AP or PA? Good, so now let's add on to that.
Left lateral
Okay?
decubitus.
This is a left lateral decubitus.
AP.
AP projection. Okay, again, just the term decubitus tells me two things, that the patient is lying down and it's a horizontal beam. So I don't have to say left lateral recumbent. Okay, I can say left lateral decubitus. Patient is lying down and they have a horizontal beam. Yes?
Does the decubitus assume a lateral recumbent position?
No, you can also have a ventral decubitus.
Yeah.
You can also have a dorsal decubitus. So if the patient's laying on their back or on their belly, okay, and you have the horizontal beam, it's a decubitus. But in the case of what you're talking about, if the patient was on their belly, it becomes a ventral decubitus film. If they're on their back, it becomes a dorsal decubitus film or image. Does that make sense? All right.
Why not recumbent versus decubitus?
Okay, recumbent just means they're lying down. Decubitus is going to be describing two different things. Decubitus, remember, for it to be considered a decubitus examination, patient has to be recumbent. So there's no need for me to say recumbent again.
Okay.
And decubitus also describes a horizontal beam. So when I say left lateral decubitus, that means my patient's laying on their left side with a horizontal beam. Okay? Let it soak in. Let it soak in, okay? Now what do we have here?
Right lateral decubitus.
Right lateral
Decubitus.
right lateral decubitus. What is the projection?
Posterior.
Right, it's a PA projection. So it's a right lateral decubitus. Again, decubitus tells me they're lying down with a horizontal beam. And my projection is it enters the posterior, exit the anterior.
So once again, if they're lying on their belly and it's like that, it would be a ventral decubitus.
Yeah, it's just a ventral decubitus.
And there's no direct.
No, you can say lateral. It's a lateral ventral decubitus.
Because
but
going in the
but the
it's
assumption already, and this is kind
because entering on the lateral side,
yeah,
right?
Because
Okay.
because of the horizontal beam, you already assume
Okay.
for ventral it's going to be lateral. Yes.
Does it make it, I mean, because I'm looking at it, and if someone were to be laying on their stomach or
Mhm.
back and it's coming from the top, now it's different.
Now, yeah,
Yeah. But what would, like, why would you choose one over the other?
Okay, good question. Why wouldn't I just have them be flat on their back with a projection going down this way? Okay? The whole purpose, that's actually a very excellent question. The purpose of these decubitus images is to assess air and fluid levels. Air and fluid levels. When you're laying on your back, for example, let's just say if we were trying to look for fluid in the lungs, and you were laying on your back, the fluids in your lungs would be dispersed. now you don't see anything. If you were laying on your side, fluid is heavier than air, so if you have fluid in your lungs, it'll settle to the bottom of the lungs, and now you can see the density or water fluid levels on the bottom lung. Okay. Same thing if you were doing a decubitus abdomen. Same thing, if we're looking for someone who has an ileus, which is a bowel obstruction, we get to see air and fluid levels and the possible obstruction of that particular structure. That's why you would do it. Yes?
Would you repeat that part about, it's a decubitus image that you're taking and the patient is supine, then what would that be?
Oh, it's just a supine position. Okay, let's just say they were on their back. It's just a supine position, and that's it. And it's going to be, if they're on their back, it's an AP projection.
But what if, I think we should, like if the beam was going through the side
Okay.
and they were supine.
Horizontal.
Mhm.
If it was going horizontally and they were on their side, like this.
Yeah, but he's on his, like,
Roll
20
him
years
over.
back.
Huh?
Laying on his back.
If he's laying on his back.
Okay, if they were laying on their back with a horizontal beam,
Mhm.
that would be a dorsal decubitus.
That's it.
That's it.
Dude, would we have to say left and right? So what's closer to the-
No, you could, if I were to ask you that, then you would talk about which side would be closest to the image receptor. So you would say right dorsal decubitus or left ventral decubitus. Okay, but we usually don't do that.
So we're surfing, we're not,
Yes,
we're going too far.
yes, yes, right now, that's what we're doing. We'll talk about it when we get there. Okay? Any questions? Okay, so remember, this is the most key important part. Decubitus means patient is recumbent with a horizontal beam. It doesn't apply to anything else. It's a horizontal beam, okay? Patient is recumbent. Now here's the third nuance. You guys ready? Decubitus images or examinations only apply. They only apply to the chest and the abdomen. Okay, so decubitus exams only apply to the chest and the abdomen. We good? All right. There we go. That's what we were talking about. I should have just thrown this up there. All right. So, decubitus, dorsal on their back, because dorsal, they're laying down. Decubitus means a horizontal beam. Okay, so it's a dorsal decubitus. It's left lateral. Okay, because the left side is closest to the image receptor. What is the projection? It's also lateral, right? It's a lateral projection. And then here, face down, ventral decubitus. Okay, lateral projection, yes.
Why would we be taking this type of X-ray?
Same thing, air and fluid levels. Now, if we were doing the abdomen for this particular study here, we are looking for an aortic aneurysm.
Is the lateral a little bit redundant because we know it's decubitus? Can we just say that dorsal decubitus left?
No, because remember, decubitus tells us it's a horizontal beam.
Right, but they're on a left or a right, and it's decubitus that's already horizontal.
Right, so we're already horizontal, but like I said, if you want to get more specific, if you want to know what part is closest to the image receptor, that's where you would say right lateral or left lateral. And sometimes we need to know that because this goes back to technique classes. Okay? If we knew what side was closest to the image receptor, we knew that that particular part is going to be more true to the size than that that's furthest away. Okay? That will also indicate what part should be closest to the image receptor, because the closer you are to the image receptor, you get true size, no magnification, but better detail. You thought 146 was, this is why you guys took 146, to understand the nuances of the changes of these different factors. Any anatomical structure that is furthest away from the image receptor, what happens to that structure?
Detail
becomes
larger.
magnified, but what happens to the detail?
It's lost.
You lost the detail, you lose detail. So that's why it's good to know if we should place the left side closest to the image receptor or the right side closest to the image receptor, depending on what area of the anatomy is of better interest.
So for these kinds of x-rays, do we still use our lead markers? Or
Oh, yeah.
We do?
Yeah. So in this case, you would put which marker? Your right marker, and then this one you would place your left marker.
So we're
Because we're not talking about which side, we're not talking about the literal left or right side of the
Right.
patient. We're
What's
talking about which is
closest to
closest to
the-
the image receptor. I know. I know. This, again, we're just starting.
Okay.
Yeah, we have another full semester to understand this. Okay. All right. Special projections, an axial projection. An axial projection is, that should say 10 degrees, not 100. Okay. An axial projection is where the central ray of 10 degrees or greater is along the long axis of the body part. I know, just bear with me, okay?